everybody. Plastic surgery can improve your image and outlook, but when that surgery is also necessary, it can really improve your life. And in those cases, insurance can help pay for it. Here to explain some of the procedures that qualify, please welcome Dr. Reginald Buford with Excel Center Houston, along with patients Sharon, Nicole, and Wayne. Good morning, everybody. Now, I have something to explain right here, okay? Doctor, oftentimes when we say plastic surgery, people think, again, it's just all about improving your looks, and that's all. But tell people what I have on right here and why it really can affect a lot of people's lives.
Well, you're absolutely right, Deborah. Plastic surgery is broken into cosmetic surgery, which is done to enhance your situation. Those people usually don't have much in the way of body fat. Reconstructive surgeries and what you have on today are patients that come in with neck, back, and shoulder pain that need a breast reduction, or they come in with this large amount of skin and excess fat, and they need a paniculectomy.
Yeah, all right, because I'm telling you right now, I put this under the commercial break. I am already, like, starting to lean over, and my shoulders are already starting to hurt. Sharon, you understand what this is like.
Absolutely.
What did you have done?
I had breast reduction done, a medical breast reduction, for all those reasons that the doctor was stating, neck pain, back pain, and you know, men are out there, and many times women are saying, well, why would you want to take away?
Yeah, exactly. We either have too little or too much, don't we?
Yes, but I definitely had too much.
Yeah.
So when I came in to explain all those things, that carrying it around, you've only had it on since the break,
yeah.
So carrying it around for life is challenging.
Literally, you would have these rudders, like right in your shoulder.
It would dig
right
into
there.
my shoulders, dig into my back, dig underneath the breast. So challenging.
Yeah. So, and that's the reason why a surgery like this could be covered by health insurance if you have it.
Yes, exactly. And you know, we went over the situation with Ms. Merrill and discussed the plan and how we were going to do the surgery, the incisions for the surgery, and answered her questions. But then we also wanted her to understand that this is a lifestyle change. Mm-hmm. We're all about not only surgery helping to relieve the symptoms that she had, but then we wanted to talk about increasing the physical activity, 30 minutes of walking 3 to 5 times a week, along with changes in the diet.
Yeah. Now, I'm looking at you going, you can wear a tank top without a bra. What kind of freedom is that?
Yeah. I can.
It changes the way that you live. You're right. It's about that freedom there. All right. Nicole, you're a police officer, mother of 3, and I'm looking at you going, you look great.
Thank you.
But there's a reason why you look great now, huh?
Yes, ma'am.
What did you have done?
Abdominoplasty.
Okay, when we say abdominoplasty, is that what people sometimes refer to as tummy tuck?
Tummy tuck.
Yes,
a lot more to it than that.
She had the cosmetic variety. Okay. So she had an abdominoplasty or a tummy tuck. She came in initially seeing if her insurance would cover the procedure, and it didn't. So we talked about, okay, we can still help you doing a cosmetic tummy tuck or abdominoplasty, but we also talked about lifestyle changes. Mm-hmm. And so Ms. Medrano is a perfect example of someone who's done the surgery, but then we said, you know, to really get it to a point where you're going to be so excited, as you change your diet and increase your physical activity, you know, I've had a chance to see her over the last couple years or so, and she's just, I mean, she's so radiant and she's in great shape, you know, and so that's what it's all about.
Yeah, I could see a lot of guys wanting you to pull them over on a stop. Yes. Like, look at that officer there. But yeah, we tell you, she's mother of 3. Oftentimes the abdomen is affected with pregnancy, and of course, you're a mother of 3 as well, and so the breasts are affected. It's like, you know, when they were up here, and now all of a sudden you had kids are down here. But so common surgeries for a lot of women. Now, Wayne, what did you have done?
I had a upper and lower body lift.
Wow.
I lost a considerable amount of weight, actually about 170 pounds.
Oh, man, congratulations.
Thank you.
Okay, and you were part of that new generation, especially with weight loss surgery. Did you do weight loss surgery to do that? Or?
Yes, ma'am.
Yeah, so especially with weight loss surgery now allows people to lose that kind of weight. What's left behind is still not the body that you really should have. And so what's involved in doing that lift?
Well, certainly Mr. Smith had a couple of different surgeries done, so everybody is different as far as where do you have this excess weight. He did have some in the front, like this apron like you have on, and he had some that went on around to the back as well and into the front. So he had, you know, many areas that can be reduced after you lose this kind of weight. But what's so interesting about Mr. Smith's story is that he not only has lost this weight, but he's training for a triathlon.
Wow. Something that you would have thought you never would be doing, certainly would have been impossible with your...
Impossible.
Yeah.
Having the skin removed increases your mobility so much and your ability to exercise and train in comfort and not in pain, and it really is a life-changing. It was a life changer for me.
And also just clothes. You're wearing the real sizes that you should be wearing.
Right. That was definitely a nice experience to be able to go to an actual store and buy clothes off the rack.
Now, it is a journey. What you went through was a journey, because you know, we always want something overnight. The reason why I think a lot of diets don't work is that if it doesn't work in the first 24 hours and I don't wake up 20 pounds lighter, I'm not trying it, right? But it is a journey, but you've gotten to the other end of that journey. And so what would you say to someone who at home is still trying to figure out what they need to do?
The first thing is do your research and find out what's going to work best for you. For me, it was the bypass surgery. And understand that the surgery is not a tool. I mean that it is a tool and it's not the solution.
Yeah.
The surgery will give you the ability to lose weight if you eat right, if you exercise, if you follow nutrition and do the things that your doctors will tell you that you need to do, and your nutritionist will tell you.
And then after that surgery, still work to do, as we mentioned here, of kind of defining that body and finally getting it to where you want it to be. I just want to round out with the fact that it's important to go to people who know exactly what to do. It's one thing to do cosmetic surgery. When you're trained to do reconstructive, that I would imagine is another level of training.
Well, yeah, and you know, you have to take people where they are. I mean, and that's what we've done in our practice. We take people where they are with the excess weight, and we talk to them, and we really get them to make changes in their diet, and they're inspired. And once you're inspired, you're motivated to make these changes, it starts to not only improve your life, but impacts your family. And so I see patients that have changed their diet and their whole family. And so they've got a son or a daughter who's overweight, and they start losing weight because they see mommy out walking. Yeah. And so she's looking great, and she's looking better than me. So I see it all the time. So it is a lifestyle change, and it's a total package, and that's really what I want to get across, Deborah, is that these people are perfect examples of how you can do surgery and add to that and look great and feel great.
Yeah. All right. I am having trouble breathing. If you would unsnap me, here. XL Center Houston brought gift bags for everyone in our audience. They include 10% off coupons for aesthetic services and skincare. They also brought a special gift bag for one member of our audience, and that is going to go to Nakia Marshall. Nakia? Whew, I can breathe now. For more on XL Center Houston and the services they provide, call 281-207-8887, 281-207-8887, or visit xlcenterhouston.com. I have to say, I've been in TV for many years, and it's the first time anyone's ever unsnapped a bra for me on TV. All right.